So if you're over 35 and you're pursuing IVF, you know the journey can be, well, it's a lot. It's full of high hopes and, let's be honest, a ton of anxiety. And then, on top of all that, you're often handed what feels like a menu of extra treatments, these so-called add-ons. And each one seems to promise it'll be the thing that boosts your chances. It's a really emotional and, frankly, a very confusing marketplace. So the question is, how do you know what actually works?
Let's just kick things off with one number, because it shows exactly why this is such a big deal. According to the CDC, back in 2019, almost two-thirds, 63.3% of all patients using assisted reproductive tech in the US were over the age of 35. So this isn't some small niche group we're talking about. This is the reality for the vast majority of people walking into fertility clinics today.
And that really gets us to the heart of what we're tackling today. You've got all these options on the table: special lab techniques, genetic screening, you name it. How are patients and their doctors supposed to sort through all of this to figure out what truly, genuinely improves the odds of bringing home a baby? Okay, so to really get why these add-ons are so tempting, we've got to talk just a little bit about the biology. It's pretty well known that as women get older, a couple of challenges pop up. Things like a lower ovarian reserve, which just means fewer eggs to work with, and higher rates of what's called aneuploidy in the embryos. It's a technical term, but it just means the embryo has the wrong number of chromosomes. And that biological reality is exactly what pushes people to look for any possible advantage they can get.
All right, so how do we cut through all that noise? Well, that's where our hero of the story comes in. A major scientific review, published in a top journal, set out to do just that, to find some real clarity in this sea of information. These researchers wanted to systematically look at the actual evidence for all these different treatments being offered to patients with advanced maternal age.
And believe me, this was no small task. I mean, just look at the scope of this thing. The team did a massive search, digging through studies published over nearly 40 years. We're talking from 1985 all the way to 2024, all to figure out what was fact and what was fiction. So after sifting through literally thousands of records, they finally boiled it all down to this number, 151. 151 high-quality studies that directly looked at how effective these IVF interventions are for this specific group of patients. This is the solid foundation of evidence that we're about to dive into. Okay, so what did they actually find after all that work? They put some of the most popular add-on treatments right under the microscope. We're going to walk through the findings on three of the big ones: a special way of fertilizing the egg, genetic screening, and a little procedure that's supposed to help the embryo hatch. All right, first up is a big one you hear about all the time: ISSC. That stands for intracytoplasmic sperm injection. It's where the embryologist takes a single sperm and injects it directly into the egg. Now, it's absolutely essential if there's male factor infertility, but it's often offered routinely to older patients with the hope that it'll just generally improve things. But does it actually help? Well, the verdict from this huge review was pretty clear-cut. For patients who don't have a known male factor issue, there was just no good evidence to back up using ICSI as a routine thing. When they analyzed all the studies, they found that live birth rates were pretty much the same whether couples used ICSI or just standard IVF. Okay, let's move on to a really big one, something a lot of people consider: pre-implantation genetic testing for aneuploidy, or PGT-A. And, the idea behind it makes a lot of sense, right? You test the embryos for those chromosomal issues we talked about, and you only transfer the ones that test normal. The hope is that this has got to lead to more success and fewer miscarriages. But what does the data say? All right, I know this chart looks a little intimidating, but stick with me, it's actually pretty simple. It's called a meta-analysis. It's just a fancy way of pulling together the results from a bunch of different studies to get one more powerful answer. Each of those horizontal lines is a different study. But the really important part is that little diamond down at the bottom. That's the grand total, the final takeaway from all the studies combined. And that diamond, the bottom line, it crosses right over that middle line. And in the world of science, that's basically the signal for no statistically significant difference. The live birth rate with PGTA was 27.5%, and without it, it was 27.2%. I mean, they're practically identical. So for this group, the review found that testing didn't really improve the ultimate outcome of taking home a baby. So up to this point, we've been talking about add-ons that, well, don't seem to help much. But this is where the story takes a really sharp and kind of surprising turn.
The review's most critical finding was about an intervention that might not just fail to help, it could actually harm the chances of success.
It's a procedure called assisted hatching. What they do is use a laser or a chemical to make a tiny opening in the embryo's outer shell. The theory goes that this makes it easier for the embryo to hatch out and implant in the uterus. Sounds logical, like giving the embryo a little helping hand, right? But take a look at this data. Remember that chart we just looked at? Same idea here. See that diamond at the bottom, the overall result? Notice how it lands clearly on the left side of that center line. On a chart like this, that means the evidence actually favors the group that had no assisted hatching. In fact, the numbers were pretty stark. The live birth rate with assisted hatching was only 19.6%. Without it, it was 26.1%. The study's authors themselves were so struck by this that they wrote this quote, saying the finding raises concern about how widely this is being done for no other reason than a patient's age.
Okay, so we've looked at a ton of data. What does this all actually mean for you? The goal here is definitely not to create a bunch of strict rules or tell anyone what to do. It's about arming you with the science so you can feel more in control and have better, more informed talks with your doctor and your whole care team.
You know, this summary quote from the study's conclusion just nails it. They failed to find an advantage for a lot of these common add-ons when they're used routinely, and they found a potential harmful effect for routine assisted hatching. The big message here is pretty simple. When it comes to IVF, more isn't always better. So how do you put this into practice? It really boils down to asking the right questions. The next time an add-on is suggested, you can feel confident asking things like, is there really strong evidence that this works for someone in my specific situation? What are the potential downsides, like we saw with assisted hatching? How does this choice affect our overall plan? It's all about building a partnership with your doctor, one that's built on the best science we have.
Look, this whole journey is filled with so much hope, but also so much uncertainty. Trying to figure out the world of IVF add-ons can feel like just one more giant hurdle. But maybe, just maybe, the most powerful tool you have isn't some newfangled lab technique. Maybe it's just having the knowledge and the confidence to ask a simple question. What does the evidence say?